Okay, today we're going to talk about Calcaneal Apophysitis. It's also known as Sever's disease. It's basically a growth plate inflammatory state. So every time a younger kid comes into my office who's between the age of, let's say, 9 to 13, usually boys, sometimes girls, and they're talking about heel pain, pain on the sides of their heel or on the bottom or the back, 99.9% of the time it's calcaneal apophysitis. So what's happening is they're usually athletes or somewhat active. The Achilles tendon comes down and inserts right in the middle third of the back of the calcaneus, your heel bone. It's pulling really strongly. When you hit the ground, walking or running, it hits right there as well if you're a heel striker, which most people are. And on x-ray, which I'll show you, there's a growth plate right here. Now, a growth plate is a soft section of bone. It's somewhat like cartilage, where for younger kids, they're still growing. It's the area where the body's laying down new bone and the bone's actually expanding and growing. Because of the impact right on that growth plate and the pull of the Achilles, and the fact that they're an athlete, where when you take a really powerful stride, 7 to 10 times your body weight goes crashing through that area, that softer portion of bone becomes inflamed. It's a little loose at the micro level. It shifts at the tiny micro level and becomes irritated, and it's not ready for this kind of pressure, unlike a mature bone would be. So I can almost diagnose this one from the parking lot. Young athlete, heel striker, heel pain's been going on. The nice thing is eventually you're going to grow out of it, but for the time being you're stuck. So what are we going to do about it? Initially, that can be super painful. It can, it's a lot of my patients are football players or soccer players, and it might end their season if they're not careful. If it's really painful, the initial approach is to wear a cam boot. A big, tall, stiff boot. I'm not a fan of the short ones, as I've mentioned before. It needs to be a big, tall one. Ibuprofen, according to their weight. So I'll leave that up to you and your doctor. Ice, 20 minutes on, 20 minutes off, and lots of rest. Now, that's going to feel amazing. It's going to feel great. Most of the pain's going to go away. And what I find is that as soon as the patient goes back to activities, back to their sport, the pain comes right back, or at least pretty quickly. So what do you do about it? How do you go about getting them back to activities without waiting 3 or 4 years for them to outgrow this? Once the growth plate closes and they're fully grown, this usually isn't a problem anymore, unless the growth plate closes in a very unusual way, which I've never seen. Usually they're fine. So when I started my practice, Dr. Lowe, who was my predecessor, first few days he said, Dan, if the kid comes in with this story, put him in a rigid custom orthotic. This is a polypropylene shell. You can fit it in a cleat, tennis shoe, running shoe, basketball shoe, whatever. He said, make the heel cup deep enough and make the orthotic strong enough, and their pain will go away. 100%. 100%, I was very skeptical at first. Well, I'll have to say that after 8 years of practice and making custom orthotics just like Dr. Lowe used to, it works. Now, the kids may not be 100% pain-free, but 100% of the time, the kid usually comes back and says the pain is good enough that they can play and they're not really perturbed. They're not inhibited, and they feel like they're at full force. So that's pretty cool. The reason the custom orthotic works so well is that there is so much motion when you run around the heel bone. You strike, you lift off, the Achilles is pulling. There's all this motion, especially when you're out in the grass, uneven surfaces, and cleats. So you're balancing on 2 or 3 little cleats right around the heel. It's really an unstable environment. So when we combine the orthotic, which is very rigid and a deep cup, inside a really rigid shoe, you limit enough of that motion that the growth plate doesn't get as inflamed. They're still going to move around. There's no fear that their muscles are going to atrophy. That's a big one I hear all the time as well. If I rely on a rigid orthotic, isn't my foot going to become soft and weak? And it just doesn't happen. All you're doing is changing the surface that the foot sits on in a more favorable position, and you're limiting some of the motion. All the muscles are still firing, all the tendons are active. It doesn't act like an ankle brace or a back brace where, yeah, if you wear it all the time, you're going to lose some power and strength. This is simply changing the contour and stabilizing the foot. But it works. It works well. It takes away enough of the stress that almost every one of my kids is out there playing sports. They're doing it well. The only downside is custom orthotics are expensive. In my office, we charge $375 for a pair. The way we make our orthotics is we use foam molds. It's very much like the foam you see in a florist shop where they put the flowers in it. You take a quick impression of the foot. You can control the position of the foot very well. We do it in a sitting position with a little bit of pressure on it. If you do it standing up, the foot collapses too much and you're not correcting for overpronation or other problems. So with them sitting and a fair amount of pressure on the knee, you can get a semi-weight bearing position, which allows for a little collapse of the foot, but not so much that you're not providing any support or protection from pronation. So we use a foam box. We make the orthotics ourselves. A lot of people mail them out. It doesn't really matter. The fact is that when it's made well, it works very well. The big drawback with orthotics is that you do grow out of them. And kids are growing fast. I think my record holder as a kid grew out of these in like 3 or 4 months. I can usually get a year out of them, if not 18 months, maybe 2 years if you're not growing a whole lot. But inevitably, kids come back and say, you know what, these orthotics work great for about a year or more, and my pain has started to come back again. I'll measure their foot, and sure enough, the ball of the foot, the foot has grown in length, and the ball of the foot is now too far away from the lip of the orthotic for it to control the foot well enough. I like my orthotics to come right up to the heads of the metatarsals. So we're talking something like that. Everyone's a little different. If you go a little too long, you fill the lip of the orthotic. We can cover these in padding. We can put padding all the way out to the toes. We can do short padding. For athletes, I usually don't. And they don't fill it. We can bevel this edge so finely into the ground that they don't really fill the lip. But you have to have it as long as they'll allow, and that'll control the foot well enough that it controls this problem. So that's it. It's super simple. Custom orthotic cures them every time if the orthotic's made well. It's one of the nicest things we treat because it's so predictably done well. I have tried other orthotics like Power Steps and Super Feet, and I often fail. They're just not rigid enough, they're not strong enough, and I think mainly the heel cup just isn't deep enough. You have to have a significantly deep cup, otherwise it doesn't control the movement around the calcaneus enough to get rid of the inflammation, allow those tissues to calm down and heal. Like I mentioned before, thankfully this is one of those diseases where you're going to grow out of it. Somewhere between 15 and 20 years old, kids are fully grown, the growth plate closes, and the problem is usually gone, and now you're on to more plantar fasciitis and Achilles tendonitis that we old folks have to deal with, but at least this problem disappears, and we usually don't hear from it anymore. So that's it. Please remember that we're doing these lectures to not only help our patients remember what we've talked about in clinic, but to also raise money for Operation Underground Railroad. We're doing this for free, so please go to their website. That's O.U.R rescue, ourrescue.org, and we would love it if you made a donation to Operation Underground Railroad for an equivalent amount that you would have spent in a doctor's office if this has helped you out. Please remember that Operation Underground Railroad is fighting child sex trafficking around the world. These guys are amazing. Tim Ballard is an amazing person that's put this group together. They've saved thousands of kids, children around the world from sex trafficking rings, and it costs a lot of money to do that. So we are hoping to generate enough funds to aid in a mission and help these guys out. So please donate, and we'll talk to you later. Thanks.